Chiropractic is a branch of the healing arts which is based on the premise that good health depends in part on the correct functioning of the nervous system. It is characterized by specific adjustment of the spine and related structures.
My name is Darragh. I am a chiropractic practitioner practicing in Melrose, Massachusetts. The name of my practice is Bay State Center Family Chiropractic. We've been open since June of 2003. And I'm going to give a little bit of insight and hopefully answer questions and dispel some public perception as to what chiropractic is, where it came from, what it's grounded in, and what it consists of, and how it helps, or how it can help and should help so many people. And at the same time talk a little bit about the underutilization of our services and how if more people did get their spines checked and their subluxations corrected, that we would have less health problems in this country, people would live a much healthier lifestyle, and the ultimate impact that it can have on a global public health set. Back in 1895, chiropractic was uniquely discovered by a gentleman by the name of D.D. Palmer, and D.D. was a magnetic healer, and back in the day that was in line with healers at the time. So physicians really didn't know much. We didn't have many medical advances, we didn't have any vaccines or pharmacological interventions, and so magnetism was actually a common form of healing back then. The first, for lack of a better word, adjustment, because it was very crude, was given on a deaf man who was deaf for 17 years. His hearing became restored when he actually got his neck basically adjusted. So back in the late 1800s, they thought chiropractic was a cure for deafness. When in fact, it was called the crack heard around the world, when people actually came out to, of all places, Davenport, Iowa, they thought that this was the answer. Well, most people's hearing didn't get restored. But then what happened was they started seeing other health issues improve, better body function, other problems, other health issues started getting better, and they didn't know why. The practice of chiropractic actually didn't get defined, or the word chiropractic, which means done by hand, did not actually get defined until the early 1900s. And then D.D.'s son, Bartlett Joshua, or B.J. Palmer, was actually who was known as the developer of the profession. And he was the one who marketed and advertised and researched the profession and started the schools and actually tried to develop the profession. And then it has grown to about 60,000 practitioners nationwide and is continually growing to this day. Chiropractic basically embodies a philosophy, a science, and an art. So we always say the three parts of the triangle. The science of chiropractic is on the cutting edge of neuroscience and neurophysiology and understanding the brain and how the brain functions and works and how our body heals. The art is how we do what we do. The philosophy says why we do it. Finding the right practitioner is extremely important, and being comfortable with that individual is very important, and it's part of your healing process. A vertebral subluxation, in essence, in a general layman's term, is when the bone goes out of its normal position and puts pressure and disrupts communication from that nerve. This, in fact, affects not just the neurological aspect between the brain and the rest of the body, but it also affects the muscles, the tendons, the discs, the ligaments. So it's a very multifactorial approach to dysfunction into the body. Chiropractic's job is to locate, to analyze, and to correct these vertebral subluxations. The practice of chiropractic has expanded very much into, in addition to correcting and locating and correcting these subluxations, has advanced into the restoration of posture. So we understand that as our normal skeleton, we have a normal cervical curve, which is the neck, a normal thoracic curve, which encompasses all of our ribs, and a normal lumbar, which is our lower back. At the same time, normal pelvis, which is what enables us to walk. This is a healthy structure. The curvature is well preserved. The curves are in good spot. The disc spacing is fairly well. This is an actual patient. And basically this patient can absorb forces, traumatic forces, so that their body is going to function that much greater. This is what we try to like all of our patients to be, although a lot of times they wind up looking like this. This particular gentleman had come to me with lower back issues, but also expressed a history of neck complaints, and that he had never actually he had gone to physical therapy, and he had never really gotten, his neck had never been adjusted. But at the same time, when we x-rayed him, his curvature was almost going into a reversed. His discs in between his vertebral levels were actually starting to get malpositioned. So even though he had gone under physical therapy to decrease his pain perception, and maybe his muscles were more balanced, his bone structure was malpositioned. Over time, through gravity, is going to wear these bones down faster, is going to predispose him to possible disc problems, and in the long run, he will actually probably suffer other complaints if this was never corrected. This is probably the reason why this is an unhealthy spine. At the same time, he did have numerous subluxations in his spine that were asymptomatic. So, and that's a really good point to make, that sometimes you can have asymptomatic problems, still be unhealthy, and this is why they need to be corrected. This is an educational sample demo just displaying the manifestation of headaches and how different postural problems or different subluxations on the x-ray can lend itself to contributing towards a symptom of a headache. The future of chiropractic is basically trying to bring the skeletal structure back to a more normal presentation. As that happens through the adjustments, through ancillary procedures in our office, then the body can function and heal at its optimal level. This is where the most research has been done. This is where the most advanced techniques have come out of in terms of postural correction, and also understanding greater neurophysiological and neuroscience concepts as to how the nervous system works, how it reacts to an adjustment, and at the same time understanding the forces that occur when making an adjustment, and how sometimes when I adjust a little child, I have to alter my technique as opposed to if I'm adjusting, say, a big football player or an osteoporotic woman or someone in a wheelchair. So we always have to modify our techniques to fit that particular individual. Chiropractic, I believe, is on the cutting edge of healthcare because it's the one health profession that actually focuses on restoring health and not masking up symptoms. So where we're actually focused also on what's called deductive reasoning as opposed to medicine, which is based upon inductive reasoning. So if someone goes to the medical doctor and gets their labs drawn, and they get a lab say, oh, your cholesterol's high, your thyroid stimulating hormone's high, then you must have this. So therefore we have a drug to treat that particular ailment. So all of a sudden then those are problems that are addressed. Chiropractic says we're going to make the body function that much better to suit the environment so that it can function and heal that much better. So a lot of times people that have health problems that walk through the door, the reason their health problems get better, regardless of what it is that they have, is because their bodies are functioning better, their bodies are healing better. Now that we do understand how and why it works, and science has evolved and explained how the adjustment works, and we can explain this much needed health service needs to be offered and advertised to many, many more people. And because if many more people did realize the benefits of getting adjusted into their daily lives or into their health regimens, just like brushing our teeth, then we probably would have less health problems in this country. We would have a healthier population. Chiropractic also makes us healthy as a whole, and in doing so allows us to make better choices. So chiropractic patients actually make smarter choices about their health. They tend to exercise more, they tend to eat healthier, and they tend to be a little bit more proactive in their health. As I joke around, I tell people if I could give you a pill that could correct your posture and remove nerve pressure from your spine, I probably would invest in it. But unfortunately I can't, and so that's why a lot of times we have to see our practice members quite frequently in the beginning, and then over time it's more of a maintenance approach to taking care of oneself throughout their life. The majority of chiropractors ascertain more hours than a lot of physicians in medical school. Most people don't know this. We have a lot more anatomy hours. We have a lot more hands-on. So for the first 2 years in chiropractic school is identical to medical school, osteopathic school, dental school, podiatry school. And then from there, after the first 2 years, you sit and you take your national board exams, and the dentists take their dental exams, and the podiatrists and the medical doctors, blah, blah, blah. At the third and fourth years, where medical residents start to learn more about pharmacology, chiropractors start dealing with hands-on approach and learning techniques to the body. Chiropractic school, pretty much about 4 years in length, encompassing the basic sciences, gross human anatomy, cadaver dissection, diagnosis classes, ranging everything from all aspects of the body, cardiovascular, kidney physiology, as well as learning all about the brain, neuroanatomy, neurophysiology, techniques, studying research techniques, as well as learning all different kinds of techniques out there. As I mentioned before, there's about 150 different techniques. Now granted, you can't learn all the techniques in school, but you try to get exposed to as many as possible. After you complete your 4 years of chiropractic education, you have to sit for the state exams and actually the national exams. So there's the National Chiropractic Boards. There's 4 parts, Part 1, Part 2, which are the basic sciences, Part 3 is more the diagnostic, and Part 4 is actually the physical hands-on simulation exam, which also encompasses all the radiological aspects as well. We read x-rays, we interpret x-rays, and at the same time refer out when there is a pathological problem on an x-ray to the respective clinician. Chiropractors can also have specializations. This is basically what's called the diplomate program, which is about 3.5 years post-chiropractic graduation. There's board diplomates in radiology, in orthopedics, in nutrition, in pediatrics. They become this highly specialized individuals who deal a lot with these in specific cases. The licensure varies from state to state greatly, and most people don't understand this or don't know. In states such as Florida and California, to get licensed for that state, you have to sit for their individual state board exam. The national board exam doesn't necessarily apply to that particular state. You can do various internal examinations, prostological examinations, vaginal examinations, as well as order a plethora of all kinds of invasive testing. Whereas if you go to a state, say like Massachusetts or Michigan, the scope of practice is very limited to the correction of vertebral subluxations, nutritional supplements, and some things such as physical therapy modalities, embraces, traction, along those lines. So the state laws very much dictate the practice in that particular state. Not all chiropractors use tools. Some use just their hands, but there's many ways of adjusting, and this is what encompasses basically the art of the profession. The body, as we work directly with the nervous system in the body does not know the difference between any of these techniques that are utilized on them. So, but the patient or the individual that is being adjusted understands the different techniques that are used. So whether it's a specific way of correcting the subluxation by hand, utilizing a specific table, or utilizing a specific instrument, all achieve the same objective. As I mentioned before, there's about 150 different techniques in chiropractic. And in doing so, every practitioner has their own approach as to how they evaluate the human body and how they evaluate the spine and the skeleton. So in addition to analyzing x-rays and actually ascertaining the postural problem, and ascertaining where the subluxation complex is, and trying as our goal and objective is to minimize the subluxation, which is going to facilitate and bring about better health in the individual, we utilize specific techniques. If I was to superimpose the skeleton on my lovely assistant Gina here, this would be the sacrum, this would be the pelvis, the lumbar spine, the thoracic spine, the cervical spine, and the occiput, and this is where the brain sits in. When we analyze a spine with someone laying face down such as this, we're ascertaining more of a pelvic position, pelvic sacral position. When we analyze someone lying on their back, and I'm going to have you come roll over for me, please. Okay. When we ascertain leg lengths on someone who's lying on their back, we're actually looking for upper cervical neurological vertebral subluxation or upper cervical neurological interference. So the subluxation basically denotes nerve pressure or nerve interference at a particular level along the spine. Neurologists use this technique as well as chiropractors. Chiropractors, I use this almost on every single one of my patients that comes in here. To analyze, correct the subluxation complex, wherever it may be, and then trying to find out what technique is going to be most suitable for that individual and at the same time most comfortable. Sometimes the technique is to get the correction, sometimes can be painful, but the insult to the spinal cord and the health of that individual, sometimes they have to undergo a little bit of discomfort in order to get the correction. Each technique basically has its own art aspect to it. And this instrument is called an activator, which we mentioned before. Activator involves specific muscle isolation tests, sometimes putting your arm on the back of your head, sometimes lifting your head up, turning your head to the right, turning your head to the left, actually isolates different vertebral levels and actually can isolate where the nerve pressure is and where that subluxation is. It also can determine the severity of it as well. Sometimes, and then we'll read the leg lengths based upon those muscle isolation tests. That's another technique, utilizing this. The other instrument, sometimes depending upon a patient's posture off of an x-ray, if someone has say a scoliosis, or if someone has what's called a hip flexion or a postural permutation in the spine, a lot of times techniques will be set up through a table such as this. This is what's known as a drop table. Chiropractors use drop work. So tables can actually be accommodated to fit an individual's posture. So the doctor must make the clinical decision as to how am I going to best correct the posture, which if poor posture is associated with what are called global subluxations. So sometimes you can have a single bone out of position, but sometimes you can have a group of bones out of position. So at the same time, the chiropractor will ascertain whether or not it's a segmental or an individual, or if it's more of a global subluxation or a postural issue. This instrument can help actually retrain the neurology in doing so and actually kind of take pressure off the nerves, correct the global subluxation, as well as correcting the posture. These are what are called sacro-occipital blocks, and blocks would be positioned in a particular way to bring about an ease or taking pressure off of all the spinal nerves in the pelvic spine. So it's allowing the patient's own body weight to facilitate and make the adjustment. This adjustment can be extremely powerful in bringing about optimal health, at the same time taking pressure off the lower back, taking pressure off the discs, taking pressure off the nerves as well. So a lot of times people in severe pain sometimes respond very effectively to these blocks. And usually we hear comments such as, I feel all this pressure being taken off my lower back. I'm going to discuss just a little bit of brief about pediatric chiropractic care, because there's either a lot of misconceptions, there's a lot of children that we can help express better life and express better health through our care, that sometimes the parents, or because of TV or because of lack of information or ignorance, people don't understand how we can help and how we can basically better their child's life. If it was up to me, I'd make recommendations for child prophylactic spinal visits, mandatory for children, because a lot of times in chiropractic, we're looking where the medical doctor is not. The first and foremost is to understand how a subluxation occurs in the body. A subluxation can occur from, first and foremost, birth trauma, can occur from falls, bumps, car accidents, anything. A lot of times what I say, I call life experiences, because basically that's, just like what causes cavities, eating. So what causes subluxations in the body? Life. This is actually a pediatric toggle board, and a lot of times what happens is the mother or the father will be holding the child, and the contact usually is made on the top bone in the body, which is also known as the atlas. The atlas is probably one of the most important bones of your body. It's definitely the most freely movable. I don't want to get into too much of an anatomy lesson, which probably already has, but this is the bone that Christopher Reeve broke. And a lot of times when the atlas goes out of its normal position, since it is the most freely movable, it is also the most richly innervated in the body. And what I mean by that is, as the brain sits right here, the brainstem comes right there. And the brainstem is very important because it controls all functions throughout our body. So if there is pressure by this bone being misaligned, then a lot of functions down below don't work as right. Once we establish a proper relationship between here, between occiput, atlas, and axis, C2, then the body has a greater propensity for health and life. So a lot of times, this particular, just to cite an example, would be used, a contact would be used with your hand right here, and it's gently coming down and just putting a slight pressure right there on the atlas, resetting that. I want to also state very importantly that chiropractic does not treat any health condition or any health ailment. And this is an extremely important note to make, because somebody would say, well, then why would I go? The reason is that chiropractic is very effective for many, many health conditions. This is extremely important, and I hate to, it may be semantical, but at the same time, to understand that as we remove interferences to your body, whether it be, and maybe give you a supplement to take which can help with your health condition and actually restore posture, as we restore function into the body, the symptom will leave, because the symptom is just a manifestation of the body's imbalance. That imbalance being the structure, the neurological aspect. So you're basically facilitating a healing process to occur. Now, certain conditions that respond very effectively to chiropractic, especially in children and babies and young kids, are ear infections, are colic, are bedwetting. And children get headaches, whether or not you believe it or not, because there's whole pediatric headache wards at the hospitals. So, I mean, we already know this to be true. Neurologists already understand this. The question is, a lot of times, from an allopathic or a medical approach, is we always want to give, as we always say, the pill, potion, or lotion to mask the effect or to help manage that condition without ever sometimes getting to the underlying cause. In chiropractic, we're looking kind of outside the box, or we're looking for that cause. And a large percentage of the time, not always, but a large percentage of the time, the subluxation is the cause of many of these health challenges, and is probably one of the reasons why that nerve pressure should be corrected. So I don't want to get into too much of a discussion on any particular health concern. If there is any health questions as to what chiropractic can help or what chiropractic is effective for, please, you can contact me at any time. The mission location took place in Fortaleza, Brazil, which is on the northeast coast. The city population was about 2 million.
In October 2005, Dr. Darragh visited Brazil on a mission sponsored by the nonprofit volunteer group Adjust World. Their goal is to bring chiropractic adjustments to parts of the world where chiropractic care is limited.
The practice of chiropractic in Brazil is very much in its infancy. The Brazilian Chiropractic Association is comprised of about 20 practitioners throughout the whole country. And there's about 150 million people in that country. So it is extremely underutilized. There were a total of 9 doctors of chiropractic, and there was about a bunch of translators and nuns and volunteers that helped out throughout the mission. There were five full days of adjusting, and to get down there probably was about a day and a half of traveling. So 5 days of adjusting and then 1 free day. We started at 8 in the morning to 1 in the afternoon, had an hour for lunch between 1 and 2, and then adjusted from 2, sometimes up until 8 or 9 o'clock at night. And then we started off the day by adjusting 250 children at a local elementary school even before we got to the missions. In the beginning, there weren't a lot of people, say like Monday or Tuesday, and people were informed through the local missions that attended the missions through their religious activities, through the church basically. They were told that we were coming, and so in the early part we had maybe 100, 150, 200 people during the day, and then around Friday, our particular mission, we saw close to 750 people. They were notified through, which was very interesting, audio boxes on tops of cars with recorded tapes. As our drivers would drive, they would be advertising us throughout the city. So a lot of word of mouth, a lot of radio, and then come Thursday we were in the local newspaper, and on Friday we were on national TV. In Brazil, this means good or good job, and so everybody would give a thumbs up. The kids, the moms, the old women, the young kids, the children. So you get a thumb up every single time. Probably not so much the most difficult adjustment, but probably the most emotional one I've ever given in my career. It's a 21-year-old little girl whose father walked her down the aisle with a staggering cerebral palsy gait, which she had suffered with ever since she was a little child. What made it so emotional was as soon as you put your hands on someone, a lot of times you can actually feel their energy and you can feel their life. And when you're dealing with someone who has no verbal communication or they have speech problems, they have to express themselves through their vocal cords. And so as this woman could not put together words, she would put sounds. And you could basically feel her trying to live as you're making the structural correction and taking pressure off of her brain and taking pressure off of her spinal cord. And so as you're restoring life back into her, or as I was, you could see her trying to live. And that in and of itself put me over the edge and was extremely emotional. I learned many things. I learned some Portuguese. It's not so much what I learned, it's basically who I became, and I feel like I became a better person, I became a better practitioner, I became a better me through the experience. I learned that I'm very fortunate to live in a country such as this in which we have many, many things at our disposal. I learned about just basic public health needs that our society is afforded that is sometimes not so in other countries such as Brazil. Just to start, but at the same time I also learned to be that much more of a compassionate, caring individual. I can't wait to serve again next year, whether it be in Brazil or Russia or El Salvador or some other country around the world.